Welcome to Dr. Osborne's Zone. Tonight is part 2 of gaming the system. Look, autoimmune treatments have failed us all. You know, you go to the doctor, you get a prescription drug, they mask your symptoms, but your disease continues to progress and you're no better off, and at the end you're actually worse off because many of the drugs have side effects that you don't want to write home about. Stick with me tonight in part 2. We're going to be talking about how you can regain your health. The system has failed us, but we're going to game the system by using some simple, actionable steps that you can learn from me tonight. Stay tuned. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's Zone. So welcome to a special 2-part series of the Dr. Osborne Zone. This is a series we're going to be discussing, which is an extension of the last 3 shows that we've done. The shows, if you haven't watched How the System Has Failed You, part 1, 2, and 3, you might want to go back and watch those. It'll get you better prepared to take on this information. This information we're going to talk about today is what I call the autoimmune revolution. This is a step-by-step guide for you to take and implement both on your own, but also if you're working with a functional medicine type doctor, to overcome autoimmune disease. So it doesn't matter what your autoimmune disease is, whether it's multiple sclerosis, rheumatoid arthritis, Hashimoto's, hypothyroidism, autoimmune hepatitis, fill in the blank. If you have an autoimmune condition and you're fed up with standard of care, if you're fed up with regular doctors wanting to mask your symptoms with medications, this is the series that you want to make sure you watch. So get your notepad ready. We're going to dive in to the depths of what you can actually implement. Starting tonight, you can start implementing this information to help your body naturally overcome autoimmunity. So without further ado, let's dive right in. So you can see here in this slide, gluten sensitivity, but also food and other chemical type reactions. Remember, chemicals are oftentimes found in your food, which is why I put them in the same categories together. So let's dive into these categories. So if we look at gluten, you know, a couple of points here. Every autoimmune expert agrees gluten was the first medically proven cause of autoimmune disease. And in my opinion, it should be the first thing that any doctor ever looks at when there's an autoimmune diagnosis. Like, gluten should be ruled out as a primary first step. I mean, I've seen 10,000 people, more than that in my career, and I've seen that many cases of autoimmunity go into remission as a result of diet change and lifestyle change, and gluten has always been one of the major culprits here. So do not underestimate the power of a gluten-free diet. Most really good functional practitioners will tell you the same thing because their experiences match my own, which is when people go truly gluten-free, they are no longer poisoning their immune systems and they have the opportunity to recover from autoimmune disease. So never underestimate the power of this diet. All grains contain some form of gluten. I think it's good to emphasize this point. A lot of people are, you know, food labeling laws are misleading, to say the least. So, and, you know, the food labeling laws say that, you know, you could have a gluten-free food as long as the food is free of wheat, barley, and rye. So if a food is free of wheat, barley, and rye, that technically, legally can be labeled as a gluten-free food. But if you look at this diagram, look at the left, here you see wheat contains, of the protein, 69% of the total protein in wheat is actually a form of gluten called gliadin. Rye has a type of gluten called cicollinin. Oats has a type of gluten called avenin, even though oats can be labeled gluten-free. I get the question all the time, what about organic oats? What about gluten-free oats? No, they all contain avenin, and avenin is a gluten, and it does cause inflammatory damage for many people with gluten sensitivity, so you have to consider this. Barley contains a gluten called hordein. Millet contains a gluten called panisin. Again, millet's one of those that's labeled gluten-free. Corn is labeled gluten-free, but contains a form of gluten called zein, and research studies have shown that zein is just as equally damaging to people with gluten issues as wheat, and in some studies it's even more damaging. And then rice has a gluten called orzonin. Sorghum has a gluten called cafferin, and teff has a gluten called pinacetin. So I show you this diagram, and you may want to pause the screen here and screenshot this so that as you're trying to navigate the gluten-free diet, you do it correctly. So many people get the diet wrong. What they do is they start buying all these processed gluten-free foods that contain corn and rice and millet and sorghum, etc., and they don't get better. As a matter of fact, there are studies that go as long out as 2 and 5 years where they're following people on the gluten-free diet, finding that in some studies as many as 92% of the patients don't actually fail, or rather don't actually achieve a reduction of the inflammatory damage. In other words, the problems continue to persist because they're eating other foods that contain different kinds of glutens as opposed to going truly gluten-free. So again, I know the food labeling laws can be very, very confusing on this issue, but I want you to have this information so that you can apply it. This is one of the biggest mistakes I see people make. Understand that testing antibodies, so they're blood tests for gluten, those antibody tests can be very misleading. You can get false negatives. It's a very common thing to get false negative tests on gluten antibody testing. This is one of the reasons why I recommend genetic screening for gluten. You either have the gene predisposition to react to gluten or you don't. So getting genetic screening can be one of the most effective ways to help you understand whether or not going on a gluten-free diet is the right move. So remember, gluten sensitivity is not a disease. A lot of people want to put it in the same category as celiac disease. Gluten sensitivity is not a disease. It's a state of genetics. You either have the genes or you don't have the genes. If you have the genes and you decide you're going to eat gluten, then your body is going to become inflamed. And the more gluten you eat over time, the more inflammation your body is going to have to deal with. And so fast forward that damage 10 years, 15 years, 20 years, this is when autoimmune disease starts to begin. It starts to develop. Autoimmune disease doesn't begin tomorrow if you eat a sandwich. Autoimmune disease takes years to develop, and the body is quite resilient and can heal until it can't, right? When the body reaches its limitation, generally speaking, that's when symptoms and disease start to set in, and this is very true of what we see with gluten. So if you're not sure about gluten, you can do a couple of things. Number one, go to glutenfreesociety.org and take our quiz. We've got a free quiz there that you can take. It's a simple quiz, and it's not a diagnosis or definitive, but it may give you a better idea of whether or not a gluten-free diet is the right move for you to make. But if you want to get more definitive, get genetic testing done. You can also do that at glutenfreesociety.org. There's a tab at the top of the page. It's lab testing, and it's one of those tests that we actually provide as a company direct to consumer because so many doctors refuse to do the right test for their patients. So take advantage of that if you absolutely need a yes or no answer. Now let's look at gluten a little bit deeper. This diagram here shows in the center gluten sensitivity, and what I want to show you is that gluten causes lots of different types of problems. It's not just celiac disease. This is another one of those myths that people with celiac disease are the only people that react to gluten. That's just not true. We've studied this. Thousands of studies have confirmed that gluten can manifest in other ways beyond the gut, meaning what some doctors call extra-intestinal manifestations. And so this is a diagram of just a small amount of those examples. You can see gluten sensitivity can lead to osteoporosis. I actually have a case right now of a very young woman who has severe bone loss in her spine as a result of an autoimmune process caused by gluten. Osteoporosis, most people associate that with this disease of aging and calcium deficiency, but gluten can cause an autoimmune response that leads to bone loss. Then we have asthma, which is also an autoimmune condition. Fibromyalgia and chronic fatigue syndrome, thyroid, particularly the autoimmune thyroid conditions, so Hashimoto's and Graves' disease. We have psychological disorders like bipolar disease and schizophrenia have been linked to gluten. And then cancer, lymphoma, has been linked to gluten. There are actually 11 cancers that have been linked to gluten consumption for people that shouldn't be eating gluten. So, if you've got a cancer diagnosis and you're watching this, you might consider a gluten-free diet. So let's look at this next slide. So these are some examples of what we call primary and secondary effects of gluten exposure. So people get gluten, and if you look at the left-hand side of the diagram, you can see primary effects. So one of the things that we know gluten does is it causes leaky gut. And that's what on the far left you see barrier permeability. That's AKA leaky gut, okay? Now there are different barriers in the body. There's the gut barrier, okay, which we would refer to that being as leaky gut if it were breached. But there's also the blood-brain barrier. And so you can actually develop leaky brain. And this is one of the mechanisms by which gluten affects people psychologically and neurologically. That's why some people with gluten develop migraines, and some people with gluten sensitivity develop diseases like multiple sclerosis. So that leaky brain can also happen. Now, you look further a little bit to the right there, you could see other primary effects of gluten. You know, again, autoimmune disease. Celiac disease is a primary example. Type 1 diabetes has been linked to gluten exposure in early childhood. Hashimoto's has been linked to gluten exposure. Rheumatoid arthritis has been linked to gluten exposure. So lots there to unpack. Then you have gluten, one of the effects that we know it has on the microbiome, so it can cause dysbiosis. There are a number of studies that show gluten's impact on healthy gut bacteria. And that dysbiosis can lead to, remember what your gut bacteria do. They make vitamins, they help you digest your food, they help prevent leaky gut, they help talk to your immune system. So those bacteria, we want to keep them intact, and gluten can damage them. So again, another primary effect. We know that some people, when they're exposed to gluten, can have an acute response or an allergic, what's called a classic allergy response. That's the hives or the swelling or the urticaria. You know, the skin breaks out in wheals or rashes. So again, some people have that acute response. Not everyone has that, and that's why it can be so difficult for many to get a diagnosis. And then we have what's called a delayed antibody response. And the delayed response is a little bit more nuanced in the sense that you don't always feel a delayed response. A delayed response is an inflammatory response. We don't always feel inflammation. And so, you know, it's obvious if we're inflamed to the level that our joints hurt, but, you know, inflammation in our bloodstream is not something we always physically feel. So that's the danger in it, is that gluten can be silent. And this is, some people have coined this term silent celiac disease, which is where the gluten is causing underlying inflammation for years and years and years before the damage becomes so great that it is symptomatic and the patient seeks out a doctor. Now let's move over a little bit and let's look at some of the secondary effects. So secondary effects, one of them is because gluten can damage the GI tract, it will cause nutritional deficiencies. And, you know, nutritional deficiencies can cause lots of problems. One of the hallmark problems is anemia. Again, that anemia leads to lack of oxygen, leads to lack of healing. But there are plenty of nutritional deficits that can cause other problems. For example, B12 deficiency can cause neuropathy. Vitamin B1 deficiency can cause dementia or contribute to dementia and brain fog. We know that magnesium deficiency can cause cramping. Calcium deficiency can contribute to bone loss and hormone abnormalities, right? We could talk for hours and hours on end about the secondary consequences of the different nutrient deficiencies. If you want to learn more about that, check out my nutritional crash course library. And then we have systemic inflammation as a secondary effect as well. Once gluten causes leaky gut, all the stuff from your GI tract, all the poop, if you will, the mixture, the milieu of poop and toxins, now have access to your bloodstream. And that once that hits your bloodstream, now your immune system has to deal with that. And that's what can cause systemic inflammation, which then, once the inflammation is systemic, the damage can occur in any tissue of your body. So organ and tissue degradation occur as a result of that systemic inflammation. So all that can be brought to you by gluten. Then we have grain. So beyond gluten, we have grain. So if you look at this next slide, and again, I mentioned my book, No Grain, No Pain. If you haven't read it, it's a great resource to tap into. But if you look at this funnel, grains come with all these other problems, even beyond gluten. So heavy metal exposures, mold, excessive omega-6, leaky gut, GMO, excessive carbohydrates, mycotoxins, ATIs, which are a form of protein that can cause gastric inflammation, and then pesticides. So these are all potential problems when you eat a grain-based diet. And go back and review some of my past videos where I go much more in depth on this. So we also have other food allergies, right? So there's food allergies, and any food. There's an old adage: one man's food is another man's poison. I once treated a young girl. She had juvenile rheumatoid arthritis. When her mom brought her to see me, she was 9 years old, and she was diagnosed with juvenile rheumatoid arthritis at the age of 2. And her knees would swell up to the point she couldn't crawl, and so the doctor, the rheumatologist for this young girl, had her on drugs like methotrexate, and they had a port embedded in her arm for IVs for pain, because she was in and out of the hospital all the time for pain care. And this little girl, after 7 years of medicating her, and those of you who don't know, methotrexate destroys the gut lining. This is one of the problems with it, is that it leads to leaky gut, which will perpetuate autoimmune disease. So it's not, in my opinion, a very helpful medication for the health of the host. But this little girl had been on this for 7 years. The doctor looks at her mom and says, "There's nothing more we can do. We don't think she's going to live longer than 6 months." And they basically quit. They give up on her and send her home to die. And of course, when I saw her, it was after that, and her mom was frantic. I mean, imagine being told your child is going to die. You're going to try to do everything within your power and will to change that outcome. So she brought her into me. This little girl was gluten sensitive, but she was also allergic to blueberries. Now, every morning, her mom would make her a blueberry smoothie for breakfast. We hear that blueberries are this wonderful superfood, and they are, if you're not allergic to them. And so that, if you look at this slide, that's why it's important to understand food and understand that one person's food is another's poison. And a healthy food can be an enemy. It's important to understand that, because if you have struggled with autoimmunity and you continue to struggle with autoimmunity, and maybe you're already gluten-free, other foods can cause and contribute to it as well, and you want to get these objectively measured. So there's food. There's also what's in foods, the chemicals in the food. So there's food additives, pesticides, preservatives, dyes, petrol-based plastic materials, environmental molds, metals. We just recently had a baby food recall on lead. We've had rice cereal recalls on lead and cadmium here in the last few years. And then there are compounds found in medicines as well as dental or surgical implants that sometimes people are reactive to as well. I've had people, there's been a number of research studies published on celiacs where they may react to their orthodontic materials because they contain wheat. So it's very important, again, if you're going to the doctor and you are gluten sensitive and you're getting braces or you're looking at a surgery, that you ask your doctor to measure to see whether or not you're reactive to the materials that they want to put in your body, whether they be permanently installed or whether they be temporarily installed. You don't want to insert something that your body might have a reaction to. So this diagram here, it breaks down for you. I think it's worth doing, because so many people don't understand the difference between an allergy, a sensitivity, and an intolerance. So this diagram, as you look at it, helps you understand this better. So if you look at it, you see at the top, allergy equals an immune response or an immune reaction. And you'll see there's two big arrows that come down off of that. Let's look at the one on the left, where it says acute. An acute allergy generally will manifest immediately and up to 3 hours after exposure. So there's this window of exposure from immediate up to 3 hours. Classically, this is what most doctors, when they say allergy, this is what they're referring to. And if you look at the acute allergy, it's an IgE type of response. IgE stands for immunoglobulin E. It's a type of antibody. And this antibody causes a release of histamine, and histamine causes vasodilation and skin rashing and swelling and constriction, the classic hallmark symptoms of an acute allergy. Now, most of you know whether or not you have an acute allergy. So it's not the acute allergies, in my experience, that are driving the autoimmune process for most people. It's the delayed allergy responses. But if you ask your doctor to measure for allergies, they're going to measure the acute response. They're not going to measure the delayed. So let's move over to the delayed. So you've got multiple arms underneath delayed hypersensitivity. You can see there's what's called a T cell response, and then in the middle you've got different antibody responses. And then you have on the far right immune complex responses. Well, all of these responses lead to chemical inflammation and subsequently tissue damage, and over a long enough period of time contribute to the development of diseases. So when most people get delayed testing, they get IgG testing only. And I think it's important to understand, because a lot of these online food sensitivity tests that people are ordering, I'm not going to mention any names, but there's some very common tests that people just go online and order, and even many alternative docs will use this IgG type of testing as a tool to measure whether or not somebody has a food reaction. And my point is, it's not a complete picture. IgG testing can be inaccurate, and it doesn't provide a comprehensive picture of the other aspects of how your immune system might be responding. You really want to get them all checked if you want to be accurate. And that's, again, it's very important that you understand that, because if you're trying to get IgG testing or simply IgE testing, you might be missing the boat on some key nutrients or some key reactions that you aren't picking up on through symptoms. Again, delayed reactions can take, there's a window. So I told you acute reactions, the window is immediate to 3 hours. Well, delayed reactions, the window is 3 hours to 3 weeks. Makes it very, very hard to keep a food diary and find everything that you're reacting to. So you should keep a food diary. You should pay attention to what you eat and listen to your body. But sometimes delayed responses are not so easily detected. Okay. Let's take a deeper look at some of these acute and subacute allergy responses. If you look at the slide here, anaphylactic shock, that's the worst case scenario, but a lot of people break out in hives, swollen lips and face, coughing, wheezing, sneezing, runny nose, excessive mucus, watery, itchy eyes. If you're checking your pulse, sometimes the pulse will go up, the heart rate and the pulse will go up, and then increased blood pressure can also be a side effect. That's because being exposed to a subacute acute reaction can cause adrenaline release and noradrenaline release, and these things will elevate your heart rate, etc. And then erratic mood changes and hyperexcitability. You see a lot of this with kids that are introduced to foods and they start bouncing off the wall. Like if you're a parent and you've got children and you noticed, hey, when my kid eats this food or that food, they really become a monster. Consider a subacute response as being what's driving that change in behavior, and pay attention to it. Now, another symptom of food allergy, if you look at this picture here and look at the back and the tonsil, you'll see there's a block of white, like a patch of white back there. Those are called tonsil stones. And what that is when somebody is chronically eating something they're reactive to, their immune system will push more resources into the tonsils to try to deal with that reaction. And so then the formation of tonsil stones can occur. And those tonsil stones are a huge contributor to severe halitosis or bad breath. So, that would give us another symptom, which would be bad breath. So if you have chronic halitosis, but you have great hygiene, look in the back of your throat, say, look in the mirror. If you've got white patches or white stones embedded in your tonsils, you're probably reacting to some of the foods that you're eating. Now again, looking at this next slide, going into delayed hypersensitivity, I mentioned the window of reaction is 3 hours to 3 weeks. And symptoms may not even be noticeable, but they can still be a burden on your immune system. So this is why it's important to have these tested. In my experience, we've seen, like in Ginger's case, blueberries were what she was reacting to. And we would never have known that without running appropriate testing. So here's some home-based action steps you can take. Number one, read No Grain, No Pain and apply the 30-day diet plan. It's more restrictive, but if you're not doing any kind of testing at all, it's one of the best places to start without testing as a guideline. Perform a food elimination diet. Pay attention to what you eat. Pay attention to how you feel when you eat what you eat. Your body will talk to you and communicate to you. It's up to you to listen to it. Number three, eliminate as many toxic exposures from your environment as possible. That's pesticides, cleaning products. Beware that many of the chemicals can come from shots. So if you're a big fan, you're running in to get, your cold jab every year, know that you could be getting exposure to some of these toxic metals, which are known drivers or can be known drivers of autoimmunity. And if you already have autoimmunity, that could be a trigger. That could be a driving force. There's a term called ASIA, which I mentioned before. ASIA stands for autoimmune syndrome induced by adjuvants, and it's the adjuvants in many of the shots that can be a driving factor behind it. So you want to be aware of that, especially if you have a pre-existing autoimmune diagnosis. You would want to have that conversation with your doc about whether it's a wrong or right move for you. Begin reading all food and other household labels. Know what you're putting in and on your body. If you can't pronounce it, if you don't know what it is, you might want to reconsider, eating it. As a start. And then pay attention to how you feel after eating or being exposed to chemicals and soaps, hygiene products, cosmetics, and perfumes. If you notice that when you apply a perfume, you start sneezing. If you notice that when you use a lotion, you get skin rashes. If you notice that when you apply a facial cream that you end up with rosacea, like these are symptoms. Your body's trying to talk to you, so don't ignore them. Some additional things you can do. If you've changed your diet, very important, if you've done diet and you've looked at chemicals and you've made as many of those adjustments and changes as you could make, and you're still struggling and you're not responsive, you might want to consider mold in your house as a potential driver for an autoimmune response. Obviously you can look for visible signs of mold. That's not hard to do. But ERMI testing, which is a type of test you can order that helps you understand the mold burden in your home, that can be a valuable tool. And then hiring a forensic mold investigator can also be a valuable thing to ensure that your air quality in your home is not riddled with mold and mycotoxins. And then a third step there would be to talk with your doctor about measuring whether or not you have mycotoxins. And this is a test that most doctors can order. Many of them won't order it. You probably would have to see somebody who does more of a functional practice, but it's something you might consider, again, if you've changed diet and you're completely non-responsive. You also want to look at installing air and water filtration devices to improve the air quality in your home and to improve the water quality that you're drinking. And so there are different options for air filters. If you look here, UV light, HEPA, carbon, air reactors, and ionization are all options. I would say HEPA, probably one of the most important on that list. Air reactors and ionization can be effective if you have a mold problem. And then water filtration options, whole house water filtrations, there's softeners, there's GAC is granular activated carbon, which is a very good filter medium. KDF is also another very good medium. Most good whole house water systems have both. They have GAC and KDF. So know what you're getting. And then there's one level higher, which is RO. And RO, most people don't put reverse osmosis on their whole home, but they put RO in their kitchens for their drinking and cooking water. It's a stronger filter than carbon and KDF. And in my opinion, if you live in the city, you should have an RO filter under your sink. There are those filters. Generally, if you look under somebody's sink that has a separate water spigot that comes out, there's like a 5-gallon tank under the sink. Those are typically reverse osmosis filters. And then if you can't do whole house water filter, maybe there's a cost inhibition for you, check out shower head filters. So what you're bathing in, that you can filter what you're bathing in. And so there's some really inexpensive, anywhere from $70 to $100 shower head filters that have carbon and KDF in them that can help keep your water cleaner, the water that you're bathing in. So toxic compounding is a driver of autoimmunity, and I think it's important that you understand it. 4 billion prescription drugs are ingested in the U.S. each year. That's a lot of drugs. Whatever happened to the war on drugs? I guess we gave up on that, and now we've just sanctioned 4 billion prescriptions a year. 70,000 chemicals are used commercially. 3,000 chemicals are added to your food supply. 10,000 chemicals are used in food processing, preserving, and storage. The EPA estimates that our homes are now 5 to 100 times more toxic than outdoor air. So you're surrounded, unfortunately, by a soup of toxic swill. And so the best way to protect yourself is to eat well and filter things. So if you look in this next image, in most cases, autoimmunity is caused by accumulated and synergistic harmful compounds. There's not typically with autoimmune disease, not a smoking gun. There's not like, okay, this one thing is the only thing that triggered it. It's usually all of these things in combination, or a plethora of these things in combination. So, the degree of a person's symptom severity is largely dependent upon their unique environmental actions and to a smaller extent some genetic predispositions. But you can see here, if you look at this bucket, you got medications, toxic food, toxic homes, heavy metals, shots, polluted air, water, are all part of what fill your bucket up. Now, once your bucket starts to overflow, it's at that point that most of you start to develop the symptoms of illness and seek out professional help. Go to a doctor. And then, unfortunately, in that line of thought, now if you go to the doctor and you're overloaded with toxins, usually the solution is the doctor prescribes you a medication that also can be toxic, and as I pointed out, nutritionally toxic, but also toxic to your GI tract and inducive of leaky gut. So this is one of the reasons why the system has failed you. So again, if you're new to that thought process, go back and watch parts 1, 2, and 3 of that series, and you'll get a deeper understanding of what I'm referring to. Now, let's talk about some additional action steps here on the food front. So if you're working with a doc, what's called HLA-DQ testing, which is genetic testing for gluten gene patterns or gluten sensitivity gene patterns. If your doctor won't order it, go to glutenfreesociety.org. There's a tab on the website. You can order it without a doctor's note. The site takes your security very seriously, and so they do not sell your information or disclose your information to anyone. It's very safe to do the test online that way. You also want to test your blood for acute allergies, the IgE responses. So you can ask your doctor. Doctors know how to do that. That's a test that your insurance should cover, that most doctors will order, is IgE food testing. But on the other end, there's delayed hypersensitivity. So testing your immune system response for delayed reactions is something doctors very rarely do, and most conventional doctors will just try to discredit it. And so, again, if you're working with a functional doctor, that's what you want to ask for, is delayed response testing. Again, if your doctor won't order it for you, we also offer this as a service at Gluten Free Society, so go check that out. We have a delayed food response, what's called an LRA, a lymphocyte response assay, that you can order without a doctor's note online if your doctor won't do it. So now again, if mold is an issue, consider the source maybe coming from inside you or from your environment, so you can get different testing as well for mold. Sometimes mold is the last domino to fall for a lot of people. Okay, let's move in next to toxic metals. Toxic metals can be a major contributing factor here to autoimmunity. You've got some of the more common ones like lead, mercury, cadmium, arsenic, fluoride, bromine, chlorine. Look, toxic metals compete with and displace healthy minerals from their binding sites in your body. So for example, lead can displace calcium and magnesium, causing the symptoms of calcium and magnesium deficiency, as an example. So we don't want toxic metals. A lot of toxic metals are damaging to the liver, they're damaging and toxic to the kidneys and to nerve tissue. So obviously we want to try to keep these things out of our body as much as possible. Lead exposure, where do we get lead exposure? Toys produced in China. There have been a number of recalls over the last several years. Lead in lipstick and personal care products. Again, usually these things are produced in China, have been recalled. Those of you who heard about Flint, Michigan, the lead in their drinking water, in the municipal drinking water source because of the erosion of the infrastructure. You remember a lot of the older pipes in a lot of the older cities are, the pipes are soldered together with lead, and so you get lead leaching. This is why I love RO filters, reverse osmosis filters, if you're drinking city water. Several potential additional sources from manufacturing. So painted dishes, canned foods, imported candies, air and water exposure, especially if you live in major industrialized cities, are all potential avenues whereby you can get lead exposure. Now, lead for many people is an accumulation issue. I mean, depending on your age, if you grew up in the 1950s and 60s, what we call the lead generation, there was leaded gas, leaded paint, there was leaded pipes. Lead exposure was a really common thing. And so lead over years accumulates within bone and within fat tissue. It can store in the body. So a lot of people start manifesting kind of a chronic lead damage, not necessarily acute lead poisoning. A lot of doctors, conventional doctors, will tell you, oh, these things are not issues unless you're acutely exposed to massive doses, and that's just not true. You bioaccumulate these toxic metals over time, and you store them in your fat cells, your nerve tissue. You can store them in your bone tissue. And so when your tissue becomes chronically inflamed, these metals can be re-released back into your circulation, causing further damage. And again, that's not something we want, especially if we're trying to overcome an autoimmune response. We also know that lead crosses the placenta. And so without detoxification or retoxification, it will take 4 generations to eliminate all the lead from our offspring. Think about that. That's a powerful statement. So measuring lead can be a very important part of a process of understanding why you have an autoimmune illness. And we also have mercury. There's this diagram here. This is from the World Health Organization on exposure to mercury and sources of mercury exposure. You can see the #1 source for folks is their silver fillings, so dental amalgams. And then you have fish and seafood, and then other food and air and water. And then there's some, although a lot of it's been since removed, but a lot of mercury earlier on in many of your shots, many of your vaccine schedule. There was a number of them that did contain mercury. Like I said, a lot of that has been removed in lieu of aluminum, which also is not good for you. But silver amalgams, if you look at this, so in 1988, scrap dental amalgam material was declared a hazardous waste by the EPA. So OSHA has certain mandates present to handle amalgam fillings before going into and out of your mouth. So here's their guidelines. Scrap amalgam must be stored in an unbreakable, tight sealed container away from heat. Use a no-touch technique for handling the amalgam. Store under liquid, preferably glycerin or photographic fixer solution. So I mean, these are some pretty specific guidelines to make sure that mercury doesn't make its way into our water supply or into our landfills and then cause a huge contamination and make people sick. So why are dentists still using silver amalgams if they're considered such a danger? I don't know the answer to that. Maybe if you're a dentist, you can chime in. But to me, this is a part of an industry that needs to go away. We need to move away from these types of amalgams. And if you have them in your mouth, it's very important if you struggle with autoimmune disease that you get your levels checked for, because they could be contributing to your problem as well. We also found, there was a study that found mercury in corn syrup. So those of you that are eating high fructose corn syrup and as part of a plant-based diet, right, approach, or just not necessarily not avoiding it, be aware that you could be getting mercury exposure there. Then we have fluoride. Americans are consuming way too much fluoride. We're actually one of the only countries in the world that fluoridates the drinking water. When we get it in the water, we get it in the toothpaste, we get it in mouthwash. The dentist wants to soak our teeth when we go in. For our dental checkups, they want to soak your mouth a lot of times in fluoride. It's just not something, in my opinion, that's a healthy thing to do. What's interesting is the U.S. Department of Health came out not too long ago, and they are planning to lower fluoride for the first time in 50 years. Why? Why all of a sudden a change of heart? Because the data is very clear. Fluoride is a neurotoxin. Fluoride damages your brain. You can see here, studies show that fluoride is damaging to the brain. Fluoride affects a section of the brain that regulates reactions to stress, making human beings easier to control. Fluoride was originally used in Nazi Germany scientifically as an experiment to control people better. And then here you've got metal in a number of the shots, and so this diagram, you might want to just pause or freeze frame and blow this slide up so that you can see which ones contain which metals. But it's important that you understand, anytime you opt in to having these things injected into you, you run the risk of these metals contributing to a problem. And so just added on an additional aspect to that slide. I'll give you a minute to screenshot that as well. So, okay, here's some home-based action steps for you. Remove any obvious potential for exposure to heavy metals. So check your cosmetics, your toothpaste, your mouthwash, your medications. Don't buy toys imported from China and let your kids suck on them. Kids like to put things in their mouth, especially infants, so you want to be real cautious there. Pots, pans, ceramic plates made in China, you should suspect is being contaminated with metal. Excessive fish intake in your diet, unless you're buying the really, really expensive tested fish, wild caught, then I would be real cautious around fish. Again, shots, install appropriate water filtration to remove as much out of the water as possible. And then rice consumption, I didn't mention earlier, but rice, research very clear on this. Rice high in arsenic and cadmium, new studies showing also high in lead. So you want to be aware of that. And then here's some more steps working with a functional doc or healthcare provider. Perform appropriate testing to identify these things. Pre and post urine chelation challenge testing can be used to measure for heavy metal. There's tests called porphyrin tests that can also be helpful. There's something called mercury tri-testing, which can be helpful, and there's something called a urine halide test that can help you understand whether you're being overexposed to fluoride, chloride, or fluoride, bromine, or other halides. And then there's some therapies that you might want to consider, if you have heavy metals working with your doctor. One would be infrared sauna, very effective. And some people opt to buy infrared saunas for their home, which is, is a great way to just naturally help your body detoxify on the regular. IV chelation, which is a more aggressive way to pull heavy metal out of your body should you have it. Again, this would be done by a doctor. Oral chelation agents can also be used. I actually have a formula, an all-natural formula called Ultra Metal Detox. And so it's one of those things that a couple times a year I'll go through several days of oral chelation just as an agent of prevention, if you will, for detoxification. And then if you've got silver amalgams and you have high mercury as well, you want to look at maybe getting those removed. If you're going to do that, work with an environmental dentist, a dentist who's trained in removing them properly so they don't contaminate you with mercury spill off. So there's a right way to do it and a wrong way to do it. So make sure that any dentist you work with on those mercury fillings are going to be environmentally trained. And so there's a website called IAOMT.org where you can find a dentist who's been trained appropriately in that way. And then detoxification support. Again, if you find heavy metal, a lot of times doing the appropriate detoxification and support, this can be done nutritionally. And again, ultra metal detox, but you can also eat foods that are what we would call functional foods. Garlic helps remove heavy metals. High sulfur containing foods, broccoli or cruciferous vegetables can be helpful in that regard as well. Eating liver can help support your own liver's ability to detox. So again, organ meats are also, functional foods that you can consume that will help support, nourish your body so that your body can detox appropriately. Look, thank you so much for tuning in tonight. And before you sign out, I want to leave you with this amazing story of an autoimmune recovery. Check this out.
I started seeing Dr. Osborne about 6 years ago. Before that, I had spent 2 or 3 years experiencing a lot of joint pain and a progressive hearing loss. The joint pain in my hips was severe enough that I couldn't sit cross-legged on the floor. I couldn't walk down the stairs comfortably. I would clutch the handrail for additional support. For 3 or 4 years, slowly, my hearing had started getting worse. And you don't notice at first. You think someone at the end of the table is just mumbling, or you think it's that individual person just never speaks up. But eventually you notice that it's you, not anybody else. And so I started going to an audiologist to get my hearing checked. My general practitioner sent me to an ENT to also check my hearing, and she checked it, couldn't find anything that was causing the hearing loss. But every 6 months when I would go to the audiologist, my hearing loss would be worse. And so I had a friend at church who had been going to Dr. Osborne for a number of years, and she said, no matter what your issue is, even if you don't think it's something that's normally treated through functional medicine, go and just see what he can do. And at that point, even if it felt like I was grasping at straws, I was ready for anything, because I'd become terrified of going deaf. And the thought of not being able to do things with my son and to be able to hear him laugh made me know that I had to do something different at that point. And if there was even a possibility that functional medicine was going to help me, I had to take it. I came to see Dr. Osborne. We went through what all my symptoms were and started to do some testing. And immediately, my genetic testing came back with a gluten sensitivity. Also found out that I had an intestinal parasite. So we started treating those things initially. And then with each thing that we treated, we would come back and retest or reassess my symptoms and see what was working and what wasn't. And it took a little while, and as things weren't getting resolved just through that sort of treatment, we started doing some additional testing and eventually found out that I had mercury poisoning. I had about 4 times the safe level of mercury in my system. So we started chelating, which is a slow process as well, because you have to draw that out of your body slowly and safely. But looking back and correlating dates, pretty much as soon as we started treating the mercury poisoning and doing the chelation, my hearing loss stopped. So before that point, I had been going to the audiologist about every 6 months. And each time I would go, my hearing loss would be worse. At this point, I continued to go to the audiologist about every 6 months because I still didn't have any confidence that it was really going to stop. But a couple years in, I still hadn't had any additional hearing loss since the chelation. So now I go about once a year just for a checkup and to have my hearing aids checked. But the hearing loss has completely stopped. And with everything that we were treating, it is difficult to parse out the effects of each thing that you have that you treat, but it's amazing in your body how many things are impacted by your nutritional levels, by your hormone levels, by things like parasitic infections or other infections that you can have in your body as well. And all those can be detected using functional medicine. The difference that you notice between working with traditional medicine and working with Dr. Osborne is the time that he spends with you. He spends a great deal of time understanding what your symptoms are, talking through them, listening to you. And then you start a process of testing anything that is suspect that could be wrong in your body, whether it's nutritional deficiencies, infections, you talk about stress, you talk about hormones, you talk about anything that can be out of balance. Where with traditional medicine, if a pharmaceutical will hide these symptoms, that your doctor pretty much considers you done. That's it. But you don't spend that time really digging into the issues and what's causing your symptoms and why you're sick. I think the biggest thing that surprised me with functional medicine was, even though it takes a while, it's the personalized attention that it gives you. And the fact that we spent several years doing additional testing, talking about my symptoms, trying to figure out what it might be. And it's not a fast solution, but it's a much more thorough solution. Working with Dr. Osborne obviously gave me the chance to save my hearing, which is a life changer, right? But also it gives me the hope that through the rest of my life, I have a tool now to manage my health. And I don't have to rely on pharmaceuticals, and I don't have to accept that symptoms are just because I'm getting older. I have a resource to go to that's going to work through those symptoms and keep me healthy and feeling good and active the rest of my life.
I first started coming to Dr. Osborne. I was a new mom. I was very fatigued all the time, and I just wasn't getting answers. I went to my OBGYN and she wanted to put me on antidepressants, and that was depressing to me. So I went for other solutions, and that's when I met Dr. Osborne. We've been doing SpectraCell vitamins and minerals, which I love, and probably for 10 years before James started having his problems.
When I was 9 years old, I started experiencing bad illness just in my stomach, really bad pains. It's just like normal things that you wouldn't expect to hurt you, like maybe stubbing your toe. I don't know, it just like hurt my stomach. I don't know why. But back then, it was like, just why are these normal things that happens to everyone hurting to me?
He was in 5th grade, and he was out on the baseball field holding himself all the time. 3 times. Went screaming to the hospital to get an ultrasound on his appendicitis, and it was never appendicitis ever. And we finally got a pediatric gastroenterologist who scoped him on both ends. And he had bleeding ulcers where his stomach connected to his large intestine all the way through his little body. He said it looked like a freeway with potholes all in it, and he was 9, so I knew we had a problem. The gastroenterologist put him on prednisone and methotrexate, which is an immune suppressing drug, and wanted me to send him back to school, and he went to a very large elementary school. At that point, I knew that if he got the flu or any little cold, it could bring him down. It could seriously hurt his little body and endanger his life. We found Dr. Osborne, and we started the SpectraCell vitamins and minerals. I think he was deficient in like 13 the first go around, and it slowly but surely lessened. Every time we take it, there's new things that pop up. His body's growing, your body's ever changing, but he's definitely healing and getting better. He's gained 40 pounds. He's not in pain. He is medically not on any prescription drugs, which in theory, I mean, I don't have a problem with if you need an antibiotic, but I don't think you should be long-term.
Over the course of these last couple of years, I've grown a lot more. Like, my rate of growth has increased. I feel great. Going to high school now, just doing normal things. I oftentimes don't even think about, oh, I can't eat that food. Oh, that makes me sad. No, I'm actually, just fine the way I am. One thing I really like about Dr. Osborne, and something that I even admire, is how passionate he is about, just getting other people well and informing them about vitamins.
He wants to know about what's going on with bathroom habits, what are you eating, what does it look like, what does your day look like, what does your pain look like, what are you taking, and he'll specifically sit there and tell you exactly what he thinks that you need to start with, and then we'll start testing. And he does like tests. He doesn't like to piece together something, so it's all fact-based on the test that he has gone out and researched and feels good about. And I like that. And you have a question, he'll flip a piece of paper over on a clipboard, draw a cell, explain to you where the receptors, explain everything. He's extremely passionate and knowledgeable, and it healed my child.
Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.